I'm Dr. Eileen de Villa, and it is my honor and privilege to serve as the Medical Officer of Health for the City of Toronto. I've been in this position since 2017 and continue to be in that role to this very day. So, of course, a significant component of the last 3.5 years was occupied by the COVID-19 pandemic. And because that pandemic was a significant, in fact, the most significant global public health emergency of the last 100 years, in my role as Medical Officer of Health, leading Toronto Public Health, the local public health department serving Toronto, responding to COVID-19 occupied the vast majority of my time and my organization's time over the last 3 years. You know, I'm proud to say that as difficult as the COVID pandemic was for everybody all over the world, when we look at the numbers, when we look at the experiences and reflect back on that which has happened, our experience in Toronto, our response in Toronto was actually quite successful. We did see a number of cases, and yes, we experienced a great deal of loss, like many other communities all over the world. We did lose roughly 4,800 lives to COVID-19, and that's to say nothing of those who continue to have long COVID symptoms or post-COVID syndrome. And those are still affecting, that is still affecting many, many people in our city. But when I look on the plus side, relative to the size of our population, we actually did quite well in respect of the impact of COVID-19. And a good part of that was because we were so successful in our vaccination efforts, and as well, I think we were successful in being able to convey to the people of Toronto what actions were required of them to keep themselves safe and to keep their families and those around them safe. So really at the end of the day, when I think about it, the Toronto experience, our relative success in the COVID-19 response was, yes, due in part to those of us who worked in public health and in healthcare, but mostly because of the many, many contributions of the people of Toronto. I think special mention should be made as well of Filipino Canadians living here in Toronto who form a significant part of the healthcare workforce, of the public health workforce, and as well of the service industry. Because without these people, we simply would not have made it. So to all of you who contributed, whether in a big way or in a small way, maraming salamat for everything that you did.
Thank you.
So I realize that, you know, it's late June. We're already in June of 2023. And many people believe that the pandemic is over. It's true that the World Health Organization has actually declared an end to the global public health emergency. But the pandemic isn't quite over yet, and COVID isn't done with us yet. Thankfully, the worst of it, the most acute phase is done. But we know that people to this day are getting COVID infections. Some people, unfortunately, are getting sick enough that they require admission to hospital or ICU admission. And in some most severe cases, unfortunately, we are still seeing deaths related to COVID. So I would urge people, especially those who are vulnerable to illness and vulnerable to the most severe outcomes associated with COVID, so those who have immune compromise or those who are older, to continue to exercise some caution. And for those of us who live around or who regularly associate with these people, you also must exercise a little extra caution. We will eventually see the end to this pandemic. Pandemics in our history have always ended. We're not quite there yet, but I know that with our continued efforts, we will eventually see this in the rearview mirror as something in the past.
Okay. Thank you.
Thank you.